Good morning and good afternoon, everyone. My name is Trish Carlin, and I am the Executive Vice President of the Elizabeth Glaser Pediatric AIDS Foundation. On behalf of EGPAF, I'd like to welcome all of you to our latest Evidence to Action webinar, which today will be focused on the New Horizons Project and tools for adolescent HIV treatment success in Africa. For more than 30 years, EGPAF has been at the forefront of research, advocacy, and service delivery programs toward our mission of ending AIDS in children, youth, and families. A core part of this work has been ensuring that infants, children, and adolescents have access to the best treatment options for an AIDS-free future. The New Horizons program was implemented in 2014 as a collaboration between Johnson & Johnson and EGPAF to better support adolescents and young children in navigating the many challenges that go along with long-term treatment for HIV. New Horizons built upon a more than 25-year relationship between EGPAF and J&J toward our shared goal of ending AIDS in children, youth, and families. We're grateful to our colleagues at J&J, many of whom are with us today, for this long-standing partnership, and would also like to thank them for co-hosting this webinar today. We're also grateful to the Adolescent Treatment Coalition for being with us today and for their collaboration in this program. Today's webinar will offer an overview of the New Horizons project and will also highlight critical country perspectives on the unique needs of treatment-experienced youth, including a new toolkit to support adolescent treatment success. I have just a few notes on logistics before we begin. Participants are currently muted, but are encouraged to submit questions through the chat function during the webinar. We will save 15 minutes at the end with a wrap-up and also the Q&A. I would now like to introduce Dr. Natella Rachmanina and Cosima Lenz. Natella oversees EGPAF's New Horizons work across 11 countries. As a leading pediatric infectious disease expert, in addition to her role at EGPAF, Natella serves as the chairperson of the Committee on Pediatric AIDS for the American Academy of Pediatrics. She is also a clinician at Children's Hospital in DC and professor at George Washington University. Natella is joined by Cosima Lenz, who coordinates EGPAF's Committee of African Youth Advisors, also known as CAYA for short. And in this role, she provides stellar technical support to country teams in the areas of youth engagement, treatment, and prevention of gender-based violence. I would now like to welcome Natella and Cosima.
Thank you very much, Trish. Thank you for this introduction. Thank you for those who found the time on very busy schedules to attend today's webinar, and absolutely wonderful thank you and gratitude to our supporters, Johnson & Johnson, who have been at the onset of this journey for this particular project and really encouraged this development and funded a lot of work around advancing treatment options for young people. Next slide, please. So this is agenda very briefly, as Trish mentioned to you. We are going to start with presentation by me and Cosima, and then Dr. Eleanor Magongo will speak with us from Uganda's perspective. We are thrilled to have several young people join us today, Julian and Ismail, and you can see the titles of the talks that will be introduced in more detail down the line. And then we're absolutely thrilled, as Trish mentioned, to have Stacey Mayer, Vice President of Global Public Health at Johnson & Johnson, to provide closing remarks and provided also ample time for question and answers at the end of all our presentations. So as Trish mentioned, we are going to talk today about the tools that were developed by the New Horizons Collaborative. But I'd like to take a couple of slides just to walk you through a little bit our mission and overall the approach of this collaborative to advancing the treatment for children. So here you can see this is a summary of the New Horizons vision and mission. And really they are both quite simple and very straightforward. We do envision the world where young people living with HIV lead full and healthy lives, fulfill all their dreams, achieve all of their aspiration, and reach their full potential. Our mission focuses on holistic, really fully integrated approach to very high quality, sustainable pediatric and adolescent HIV care and treatment, but with specific focus on those who have failed the first-line treatment regimen and are in need of subsequent switches of the regimens. Next slide, please. And the mission and the vision of our collaborative are aligned with the very many goals that many of you have heard and participated in developing and are daily working to achieve them and to bring them to the reality. These are the 1990 UNAIDS targets. These are the unmet needs of children and adolescents who are living with HIV. We are dedicated to promote treatment equity between adults and children. We don't want children and adolescents to lag behind. We want them to have full therapeutic options, absolutely a pair with the adults. And the goal for the donation part of the collaborative was to reach 5,000 patients on the second, third line, access to J&J treatment products by the end of 2020. But let me show you what these products are and how the collaborative is structured. Next slide, please. Here you can see how the collaborative is structured. You see the two major objectives. One is a donation program. This is the Johnson & Johnson providing for free the drugs, including the different formulations, to the countries in collaboration with country ministries of health. Another component of which we will be focusing today is health system strengthening. This is really aimed to improve care, improve treatment through the public health approach. Two focus areas to deliver those objectives are drug access and capacity building. And again, the presentations today are along the box on the right, capacity building. When you look at which enabling platforms and outputs we decided to focus on, the first one that is highly supported by Johnson & Johnson with absolute unlimited donation of the drug is drug delivery. And those include a very potent protease inhibitor, darunavir, and non-nucleoside reverse transcriptase inhibitor of second generation, etravirine, and includes everything from procuring the drug to delivering it directly to the customer level. Second component is a healthcare worker capacity, tools, trainings, technical assistance. We all know that area of advanced treatment options is an area that's been long neglected and requires a lot of high-level expertise, and therefore crucial for us to contribute. And in fact, today's presentation is the one where we are going to demonstrate only one part of this large collaborative work that focuses on delivering the tools to healthcare workers and beyond to improve the treatment cascade for children, adolescents, and youth living with HIV. Another part of this is operational research, cohort analysis, publication, and info sharing. And we've done a great deal of work jointly with Johnson & Johnson and partners around this since 2014. And I'm very grateful to Johnson & Johnson for funding a separate research project that allows us truly to derive the outcomes data in those who have been switched to the donated products. And finally, one of the most basic components and the one that lays at the roots of this collaborative is involving young people living with HIV, is involving patients and clients, hearing their voices and making sure they take a very strong voice in the design and implementation of our programs. Next slide, please. On this slide, I just highlight a few of the resources that have been developed. You see the map with the New Horizons collaborative countries. I do want to make a note that a couple of these countries on the map are not yet fully in the donation program, but participate in the technical component of that and healthcare system strengthening. What we have developed is just a very high level overview here, a pediatric HIV online training model for different quadrants of healthcare workers available for free online and developed under the collaborative, multiple training workshops conducted on in-country level and regional levels, technical workshops. Our collaborative has been quite renowned for holding yearly technical workshops throughout each year, focusing really on treatment failure. We have developed second and third line dosing cards for those drugs that are not the first line and therefore could advance and facilitate implementation of the program on the ground. We have developed 3 tools. One is management of treatment failure algorithm, disclosure toolkit, and the one that we will focus the most today is a transition toolkit. So let me walk you through briefly the 2 tools that we have developed in previous couple of years, and then I will let Cosima to take a lead on the tool which development she led, the transition tool with our partners. Next slide, please. So some of you have attended a co-hosted webinar with UNICEF, we held approximately a year ago on the Disclosure Toolkit, and we're very proud just to walk you briefly through this toolkit. This Disclosure Toolkit is evidence-based, probably the first and most comprehensive brief reference, the one that you can grab off the shelf and use without going to large textbook and multiple pages resources that really were tried to compile all of the global resources available right now on the disclosing of HIV status, both directions, any possible scenario we could imagine. It is a guidance and checklist tool for the healthcare workers, caregivers, adolescents in use. It includes job aids, algorithms, readiness assessment checklists. It includes role-playing scenarios that could be quite a lot of fun, believe me, to perform for each model to make it really live and relevant to yourselves when you are going through these trainings or trying to understand how to approach this topic. It includes testimonies by adolescents, caregivers, and healthcare workers, and that tool is available in 3 languages. And just to give you a little bit more of flavor of it, these are the diverse models under this tool. And you can see we have tried to cover, again, as I mentioned, all possible scenarios, including guide to healthcare workers, how to support disclosure of vertically acquired HIV, how to prepare and support caregivers at home in talking to them, youth and children who grew up with vertically acquired HIV about the diagnosis and within the family, how to support adolescents in disclosing his or her status to the caregiver and the family. And finally, 2 models focusing on guiding adolescents in disclosing their status to friends and social network. And on the right, you can see a cartoon that shows the conversation between 2 young people, also all developed with the youth input and CAYA, who you will see more and hear more today during the webinar. And then guide to supporting adolescents to disclose their status to the partner, one of the most difficult conversations young people report having in their lives. Next slide, please. Next tool is directly relevant to prescribing and managing the 2nd and 3rd line. And this one is a management of treatment failure toolkit. All of these toolkits are born out of our workshops and hearing from the country experts, ministry, pediatric providers. This is where we feel we could benefit from having abbreviated something on the go, how-to tools in our practice. And that was probably one of the most sought tools that we felt we needed to introduce. That one, how to manage treatment failure. This is aiming at identifying children and adolescents who are failing treatment, at really linking the viral load, no suppression, to true full evaluation of the client, offer evaluation and action steps in managing them, enhance timely management, and it is aimed at multiple cadre of healthcare workers, including healthcare providers, lay counselors, and MDTs, or multidisciplinary team, equally available in 3 languages. And again, next slide, please. As in previous version, I just give you a little flavor of the tool. This is just one part of it. It is accompanied by the checklist and other tools, but this is an algorithm that follows closely WHO global recommendations and other global resources. And you can see boxes in the blue are evaluation steps, boxes in the yellow are steps to take action, and definitions on the back of the steer off page that can be placed at any office in any clinic space, on the wall, on the desk, but again, accompanied by much richer tools beyond that. And finally, today, and the purpose of this webinar, I'm very proud to introduce the latest tool under New Horizons Collaborative Transition of Care Toolkit. You can see the cover of the toolkit. It's evidence-based with references to national global resources. It supports different transitions to assure continuity of care. It is equally guided at the different cadre, including healthcare workers, caregivers, adolescents, includes job aids, MDTs, school community involvement, and monitoring at the facility levels through national health system. Again, developed in partnership with countries, CAYA, and Cosimo will cover more, and also our partners from Oxford and South Africa. I'm going to transition now to Cosimo Lenz, who can walk you through the details of this tool and also lead the development of it. Cosimo, to you.
Thanks, Nutella. I'm going to briefly go over the components of the Transition of Care Toolkit and then go a bit more in detail into what each section entails. So the toolkit starts by mapping out different types of transition, as well as guidance available by country on disclosure and transition. It outlines major stakeholders and their roles and responsibilities, as well as providing guidance on clinical care transition, caregiver transition, transition of care in school settings, as well as transition of care for young women living with HIV during pregnancy and after childbirth. It also has a monitoring and evaluation section that provides guidance and facility and cohort specific tools, as well as a section on existing global resources on transition of care. And the figure on the slide is from the stakeholder section, and it outlines the changing client responsibility over time, from being a recipient of care to having more increased responsibility in their care, and then becoming more of a leader in self-management of their care and treatment. Next slide. So each transition chapter follows the same outline in providing guidance, which includes 5 steps, which are planning and preparation, client case review and assessment, which also engages caregivers and treatment supporters, transition tasks, follow-up procedures, and tracking and reporting. Next slide. So the first type of transition discussed is transition between pediatric, adolescent, and adult care, and it provides guidance on clinical transition of care, as well as guidance on transition between HIV service delivery models. And there's a few types of clinical transition which are visually shown in the graphic on the slide, which include moving from pediatric to adult or general care, pediatric to adolescent to adult care, or adolescent to adult care. And the main audience of this is really healthcare providers and multidisciplinary teams. And there's a host of different tools and resources included in this section, along with the other sections that include national and facility transition tool assessments, transition plan and forms for clients, client case review assessment forms that have sections both for providers and clients to self-assess their transition components and competencies, group activities to support transition, and sample scripts for providers to support clients transitioning within differentiated service delivery models. Next slide. So this figure outlines some major components of different stages of clinical transition by age across the continuum of HIV care, from pediatric, which includes 2 to 14-year-olds, adolescents and youth, which includes 10 to 24-year-olds, and adults, which includes 15-year-olds and older. Next slide. The caregiver transition section provides guidance on supporting children, adolescents, and youth living with HIV transitioning between caregivers and homes, and also includes a number of tools and resources such as type of information that should be included in caregiver handover documents, which is the icon on the slide. So some of that information includes the name or the type of facility, the medication regimen or doses, any allergies that the child or adolescent may have, and any other special needs. Other tools include sample caregiver change documentation and follow-up questions to assess client and caregiver adjustment post-transition. Next slide. The transition of care in school settings section provides guidance on supporting children and adolescents living with HIV during transition between schools and school levels, and that between schools can be from day to boarding school, for example. And the figure outlines some of the factors that present during transitions between education settings and levels, from primary to secondary to tertiary school. Some of the tools and resources included are potential challenges in transitions that clients face in school environments, and Ishmael is going to talk a little bit more about this later on, as well as steps to support HIV care in school settings, both day and boarding schools, and it provides more guidance on support at different time periods, from before entering into school, during school, and during school holidays. Next slide. The last chapter on transition focuses on providing guidance for adolescents and young women living with HIV during and after childbirth. There's also a lot of tools and resources in this section as well that include challenges impacting transition of care for adolescent girls and young women living with HIV between HIV and PMTCT services. There's considerations for adolescent girls and young women living with HIV who are experiencing transition around and after pregnancy. And that's what the figure depicts on the slide. And it outlines elements to consider along the cascade from before and during pregnancy, as well as at delivery and 18 to 20 months post-delivery. There's also some models of care that are suggested for adolescent girls and young women living with HIV, and some of those suggestions include mixed ANC and PMTCT or community-based ANC and PMTCT. Next slide. So the monitoring and evaluation of transition of care section provides guidance on identifying, planning, and implementing monitoring and evaluation activities of transitions of care. And there's a bunch of different practical tools in this section, including the transition planning sheet for adolescents and youth clients that has both facility and client information. And this allows for disaggregated information collection by sex, age, and transition type. Also the sample individual transition flow sheet, which is the image on the screen. And this also has additional sections for the sending and the receiving facility to update and fill out. There's also the sample transition data summary, which has both individual and aggregate levels, and the sample healthcare transition feedback survey for children, adolescent, and youth clients, as well as caregivers to provide their feedback on their experience during and throughout transition at the facility or beyond. Next slide. So I just want to take this opportunity to appreciate and recognize the vast amount of people who have contributed to this toolkit. That includes the technical working group from headquarters, EGPAF Uganda, Zimbabwe, and Eswatini, as well as our monitoring and evaluation consultants and the contributions of the Ugandan Ministry of Health and the 3 Uganda facilities providing initial site level feedback, which we'll hear a little bit more about, and the community of African youth advisors. Thank you.
Great. Thank you so much, Natella and Kosama and Trish, for getting us started on this Evidence to Action webinar. And to segue, my name is Marianne Ombija, and I work on the teams for the New Horizons project with Natella and Kosama. And I'm going to help moderate through the additional speakers and the Q&A. So just as a reminder, the question and answer box is open, and we encourage you to put any of your comments or thoughts or things that we could use during the remaining portion at the end for our presenters. And now I'm going to, next slide, introduce our next speaker alongside this theme of stakeholders. We recognize transition requires all hands on deck for adolescents living with HIV. It's complex, it requires a lot of stakeholders and a lot of thought. It's also a place where there's limited evidence, especially in Africa, where we're learning as we go, and we really look to those who are on the ground for that expertise to help us think through how to make this possible and feasible and as intensive as it needs to be for these clients who need additional support. So with that, I'm going to introduce Dr. Magongo. Dr. Magongo is the Senior Program Officer for Pediatric and Adolescent HIV Care and Treatment at the Ministry of Health at the AIDS Control Program in Uganda. So with her leadership, she coordinates the national response for children and adolescents living with HIV in Uganda, and she has been an incredibly supportive partner to EGPAF and the New Horizons project over the years. Today, she's going to share her role and insights at the country level related to the development of the Transition of Care Toolkit, and I welcome her to take the lead. Welcome, Eleanor.
Thank you very much, Mary Ann. We'll move to the next slide. So in Uganda, we learned about this wonderful tool through the New Horizons Collaborative. As you saw in Natella's presentation, she mentioned that Uganda is one of the countries that are benefiting from the New Horizons Collaborative. So we usually have annual meetings for the different country teams that are part of the collaborative. And during one of those meetings, the transition toolkit was presented, and Uganda expressed interest because, as Mary Ann mentioned, this is one of the areas where our HIV programs are still struggling. Next slide. So following our expression of interest to participate in developing this tool and to also trying it out in our country, we set up dates, and we had a team come from EGPAF Global to come and work with us. We invited key stakeholders that were informed about our plans, and these included other officers from the Ministry of Health. We had implementing partners that are mainly supported by PEPFAR, supporting different regions across the country. We had healthcare providers. We also had representation from the adolescents and the young people. So draft tools were shared in advance for stakeholders to read through prior to the meeting. Next slide. And the picture there shows some of the members who participated in the meeting. You can see Mary Ann there. She was taking us through the overview of the transition toolkit. And following a presentation about the transition toolkit, we then worked in different groups to review the toolkit and to also provide our context to the development of this toolkit. 3 health facilities at that meeting were selected to further implement the tool at the HIV clinics to enrich the transition toolkit. So the 3 facilities took on this task and implemented the toolkit, working with the HIV care teams and the young people to try out this toolkit to further add to what had already been developed. Next slide, please. So in order to start off the health facilities to begin implementing this tool for a short period so that we can further enrich the toolkit with the experiences of the health workers in Uganda, we conducted site visits to introduce the toolkit to the healthcare workers at the respective health facilities. And in the picture, you can see one of the young people making a presentation about the toolkit, and the health workers are listening in. That was at one of the regional referral hospitals in the western part of Uganda. So we had 3 facilities, as I've mentioned. One of them was an HIV specialized clinic. The other was the regional referral hospital, and the public health facility, a health center 3, within the central part of Uganda. So following the introduction of the toolkit, participants would be engaged, the healthcare workers. We had meetings that were virtual to provide insight on the use of the toolkit and to provide feedback on the content as they continued to use this tool. I must say that at this point, this process was interrupted by the COVID-19 situation. So we were not able to go for as long as we wanted with this implementation of the toolkit at site level. Next slide. So these are some of the key highlights from the facilities. I must say that the healthcare workers liked the toolkit, and the overall comment was that the toolkit is very friendly and very easy to interact with and to use. So the key highlights were that the toolkit should address the simultaneous transitions that the adolescents face. And maybe to just throw more light here, the adolescents are also further divided into small groups. We have adolescents who are pregnant. We have adolescents who have fallen out of school. We have adolescents who are commercial sex workers. And each of those different groups have different experiences that they are going through, transitioning from one phase to another. So one of the key comments that the health care providers mentioned, that it would be good to even go deeper and discuss some of those transitions that might be happening within the subgroups of the adolescents. We also, the feedback that we had was that we need to merge some of the existing tools and tables, which the team at EGPAF has been able to do in the latest draft of the tool, and that there was a more specified guidance on the timelines for transition that was also incorporated in the final tool. And important also was that it would be good to have a register that is able to track the adolescents as they transition through these different phases, and to also use peers to identify adolescents going through these different phases. And important also for purposes of continued follow-up it was raised that it would be very important to capture information on the physical address and phone contacts on an ongoing basis to continue updating these details so that at any one time we are able to track the adolescents. Next slide. So just to highlight some of the things, innovations that the healthcare providers did after implementing this toolkit. Some of the models at the participating facility was transitioning of children 8 to 9 years to adolescent clinics, or the adolescents to the adult clinic. And this was specifically done during the family and adolescent clinic days. There was also a model where they were looking at transitioning of from one caregiver to another, because we know that as we take care of the children and adolescents, they sometimes change caregivers. So they also tried that out following the use of the toolkit at the facility, and this was done on a case-by-case basis, and also through the peer support group meetings. The clinic also looked at transitioning for school-going children through the different school levels, and also transitioning for adolescents, adolescent girls and young women living with HIV during and after pregnancy. And very important, transitioning between the DSD models, because we know that the patients sometimes fluctuate in their well-beings. You might find that today a patient is stable, and 1 or 2 months down the road, they've gone from being stable to unstable, and therefore they need to transition from one DSD model to another. So the clinic also tried that out and raised an important issue that as we look at transition, we also need to look at the intersection between transition and the differentiated service delivery models, because as you transition this adolescent, it is one way of really providing differentiated care for this patient. Next slide. So some of the recommendations from Uganda is that all healthcare providers at facilities should be oriented to use the toolkit, because it's a very good tool. Information on transition clinics should be integrated into the health education talks so that the caregivers also understand what transitioning means and the importance of this forward moving from a child clinic to an adolescent clinic, and later on to an adult clinic, so that when we begin having these discussions, they are already hearing them during the health education talks and they are comfortable with them. Adolescents should be categorized to appropriately tailor the transition package, the different subgroups that I talked about among the adolescents, and the transition process should be comprehensive and should be handled by a well-trained counselor, because there are a number of issues that the adolescents are going through. So you want someone who has good experience in counseling to support the adolescents. Next slide. So I would like to acknowledge the following people: the Ministry of Health, the implementing partners, the health facility teams, the EGPAF team, for giving us an opportunity to contribute to the development of this very wonderful tool, and the New Horizons a team that is providing us with the drugs for our children, but also giving us capacity building opportunities, and also providing us with these tools that will help us improve our national programs. Thank you very much. Over to you, Marianne.
Wow, thank you so much, Dr. Magongo. As you can tell, Dr. Magongo is both a stakeholder and a great advisory resource that we had in Uganda, and someone who's really leading the charge to take what's in this toolkit and localize it for the entire Ugandan context, which I know is a great asset, and we're really thankful for that. So moving from country to global perspective, I want to introduce our next presenter on this panel for the webinar. Julian Kerbassian is the Adolescent Treatment Coordinator, and he's based in Lebanon. He's newly appointed coordinator of the Adolescent Treatment Coalition, and this is a coalition that EGPAF has been a part of for a number of years. It's a coalition led by the International AIDS Society, so we appreciate his time right before this big conference they have coming up. And we're really happy to have him here because he's going to bring his lived experience and advocacy skills from this diverse network of stakeholders who are all working towards making sure adolescents living with HIV can access quality HIV care and treatment. We bring him here today to talk about the network itself and also help us see how tools like what the transition tool has been created for the New Horizons project are important across the global context. So welcome, Julian.
Hello, everyone. Thank you for the introduction and for the opportunity of being on this webinar. Adolescent HIV Treatment Coalition, One World, One Coalition, One Voice. Next slide, please. Adolescent HIV Treatment Coalition is a coalition hosted by the International AIDS Society. We are a diverse network that advocates for accessible quality HIV treatment and care for adolescent and young people living with HIV. The ATC is comprised of a wide range of stakeholders from global to regional networks of people living with HIV, international and national non-governmental organizations, community-based organizations, researchers, research cohort, and treatment advocacy organizations. Throughout this presentation, I will be discussing about how did we start, the history, some information about us, about the work that we have been doing throughout the years since the ATC has been formed. The need of the ATC came in 2014 when organizations who work on treatment access for adolescent and young people living with HIV had thought about actually having a platform that unifies all their voices and unifies all their asks. So basically, they wanted to have this platform to be a collective voice and promote accountability in the HIV response to the realities of adolescents living with HIV by calling to the attentions to the gaps and proposing solutions on the adolescent HIV care and treatment issues. Some of our members, including the ones already mentioned in the slides, adding to them as well Youth-Led, Youth Rise, Sibamina, UNICEF, Ugandan Network of Young People Living with HIV, and also the Zimbabwean Network of Young People Living with HIV. So all of them came in together to basically see how best they can coordinate and how best they can unify their voices. The first meeting of the ATC before it was formed happened in 2014, and then discussions started to happen on what to call the platform, how to coordinate this coalition, where do they want to go, what are the plans, the strategic directions, etc., etc. So step by step, the identity of the ATC started to become more visible and more formed until 2015. It was officially announced and having the International AIDS Society as a host organization for this coalition. Throughout the years, ATC has been present advocating for the rights of adolescent and young people living with HIV in several international conferences and high-level meetings. Next slide, please. Our vision is to advocate for quality treatment and care for all adolescent and young people living with HIV through an amplified collective voice, and our mission is to provide a global adolescent-centered platform to inform and advocate for better HIV treatment and care. Next slide, please. Throughout the years, the work of the ATC has been focused on 4 key advocacy themes, which are meaningful engagement of adolescent living with HIV, differentiated service delivery for adolescent living with HIV, optimization of treatment options for adolescents, and also providing strategic information and data. Next slide, please. our work, since the formation of the ATC, we have been engaged in several programs and implementing several initiatives focusing for sure on our four strategic directions. The ATC has been a stakeholder in adolescent HIV research. It worked closely with research cohorts and institutions to enhance community reach, as well as to evaluate opportunities to develop new research protocol. Among those are the Global Pediatric and Adolescent Research Agenda. The ATC took part in the Global Pediatric and Adolescent Research Prioritization process led by World Health Organization and CIPHER. The agenda helped focus future research and funding to inform policy and programming to ensure better outcomes of children and adolescents living with HIV. On the other hand, as well, the ATC recognized the importance of engaging and empowering adolescent and young people living with HIV so that they will be able to lead on the decisions that affect their lives. For that reason, the idea of the Intergenerational Summit for Positive Youth Leadership came in, which was also implemented on several versions. The summit aimed to foster a dialogue among youth positive leadership in the HIV response to understand the status of the global spaces that impact and engage young people living with HIV, leverage solidarity and action to improve the engagement and development of adolescents living with HIV and young people living with HIV networks across the world. The Intergenerational Summit as a summit basically that helps youth networks, regional and local and global youth networks understand more the HIV/AIDS epidemic, understand more and actually voice out their challenges, their needs. They come together for opportunity to network, to build their capacities as well. Some of our work also is the differentiated service delivery. It's basically development of infographic video stories to exemplify the importance of DSD for adolescents. The video series featured four characters who are Jane, Vincent, Namusoki, and Poon, who shared their stories and explained some of the challenges they faced as adolescents living with HIV and how DSD supported them in actually overcome the challenges that they are facing. The ATC worked on its yearly advocacy calendar where we plan for our advocacy priorities for the year, and we plan actually on sharing our specific messages and advocacy asks throughout the year. Next slide, please. Currently, we are in a changing process. The ATC currently is in the process of developing its new strategic plan with the support of all our members and our steering committee members. As you know, the world is changing, so organizations and coalitions need to always be changing and need to always looking to the challenges and to the new technologies that are coming in. For that reason, we are currently in the process of developing our new strategy, which will be launched soon. Next slide. Our advocacy theme for this year is It's About Time. This is our advocacy campaign, which will be highlighting advocacy days for 2020 and 2021. How are we going to be highlighting that? Through sharing blogs, youth-friendly materials around treatment literacy, adherence to treatment, and youth leadership. Why it's about time and why now it's about time? Because it's about time young people become louder and bolder. It's about time young people lead the HIV/AIDS response. It's about time young people make informed decisions about the treatment which affect their lives, their health, and their bodies. Next slide, please. For more information about our work, I do invite you to visit our Facebook page, our Twitter account, and our website. Adding to that, Adolescent HIV Treatment Coalition will be having a virtual booth at AIDS 2020 Virtual. I would as well like to invite you to join us and ask us our questions over the virtual booth. Thank you.
Great. Thank you so much, Julian. I'm glad that you got to share more of the ATC with our community who's attending right now. I think it's a great platform for anyone with a shared interest, and EGPAF definitely shares this commitment to optimize treatment and engaging young people. So next slide. It's no accident that the next speaker is going to be Ishmael Haradimana, who's from Uganda. He actually wears many hats, but this presentation, he's going to be talking about his role as a committee of African youth advisors who were instrumental in helping develop a number of the New Horizons tools, but especially the transition one. There was a significant leadership role. Just to give you an idea of some of the other hats that Ishmael wears, he's also a Uganda young youth and adolescent peer supporter. This is a new lay cadre that has been supported through the Ministry of Health, along with an RAL ambassador, which is a youth leadership role that EGPAF supports through our care and treatment services in Southwest Uganda. He has grown up with HIV in rural Southwest Uganda. He's faced so many challenges, but he is one of these young people who just is committed, driven, out in the field all the time, and a great insight for the practical realities of what young people growing up with HIV face. So today I'm gonna introduce him and allow him to talk about his insight and contribution for the transition tool for the New Horizons project. So welcome, Ishmael.
Welcome, thank you, Marianne. Good morning, good evening, everyone. I'm going to be sharing about our contribution toward the contribution and support toward this transitional toolkit. Next slide. CAYA stands for a Committee of African Youth Advisors. We are 20 young people aged 15 to 19 years from 11 EGPAF countries. In the photos, those are young people from different countries, including me, as you can see in the photos. Next slide. What is CAYA and how it works? EGPAF recognizes that meaningful participation of their youth is integral to future success of programs, a dynamic partnership with youth across EGPAF countries to better align global investment towards EGPAF's mission. In the photo, it's Tema and Mitsubishi CAYA member in Eswatini. Next slide. CAYA contribution to the transition. We are CAYA members who contributed to this transition. We are part and parcel of this transition right from the start. CAYA leads Uganda, Zimbabwe, and Eswatini worked in the technical group. Uganda, we had Bena, Zimbabwe, we had Glaser, and Eswatini, Mitsubishi. They participated in technical working group that was 2019. And all of us as CAYA members, we provided insight on transitions. That was August 2019. CAYA members participated in Kenya. That's Joshua, Eswatini, Mitsubishi. They were in a panel during the New Horizon Technical Working Workshop, that October 2019. And in Uganda, it was 2020, February, where we had a consultative meeting and site visits, where I was also part of it. Next slide. CAYA task. We were asked as CAYA members to share our experience, needs, and areas of focus to support adolescent and young people living with HIV in transition of care. The survey was completed by us from 7 countries, CAYA members, where we shared our experiences with transition, clinical, PMTCT, school, service delivery models. We gave advice for providers in supporting adolescents and youth living with HIV, experiencing transition. I will give advice to other adolescents and young people living with HIV, experiencing different transitions. Advice to other adolescents and young people living with HIV on transition to self-management. Next slide. We also, as members, we also give advice on expectations during transition for adolescents and young people and providers. We shared what should adolescents expect when moving to adult care. We looked at to self-manage more of their care. There will be no escorts to the facility. You will see changes in service and the way services are provided. You need to know more about HIV and their health and treatment. What providers should expect from adolescent moving to adult care. This is a new environment for youth. They don't know anything, everything. They are afraid, anxious, and confused, and may be in denial. The providers should know that. They have multiple questions to ask, and would be beneficial for a provider to take time to answer them. They appreciate respect. They should respect the caregivers, providers should know that. The psychosocial support needs are different from those of child and adults. Providers also know that. Next slide. Well, as CAYA also shared tips of self-management. We shared where we use alarms, watches to remind you to take your medication, use pill boxes to carry medics in bags, use medication to prescribe by your doctors, attend appointments and viral load testing as scheduled, attend support group meeting to meet with peers, find a routine that works for you and your schedule, be proud of who you are and accept the things that you can't change. Know that self-management is not easy and you will forget or skip taking medication. That's okay, but make sure you keep going. Next slide. We also looked at challenges with transition in school setting. When we looked at types of school transitions, we looked at primary school to secondary school and potential challenges. We looked at risk of accidental disclosure, adjusting to new medication schedule around the school timetable, handling to disclosure with new peers, partners, teachers, and school nurse, keeping or finding new treatment supporter, declining caregivers' involvement in treatment management and clinic attendance, day school to boarding school. We also looked at handling disclosure with new peers, partners, and school nurses. Here you're knowing with your mommy, your daddy, reminding you of taking medicines. So we also looked at identifying places to secure and confidentially store the medication. I remember, for example, for me, I used to hide my medicine, the sugar. So when I looked at school and boarding, so I had to make sure to look at a way I can keep my medicine. So entering school, they would always check at the gate. So I had to make sure to hide my medicine in my sugar. So children transition to boarding, we shared how they can be guided. Secondary school to tertiary institution, I share a new facility for HIV care. For example, you've been secondary in the local, then you go to the city, so you need to find a facility, new facility where to get your medication, identifying a new confidential treatment supporter, increase self-management of HIV care and overall health, including sexual and reproductive health. Out of school, we also looked at adjusting life and HIV care schedule, finding confidential treatment per day if there isn't one at school or at home. Next slide. Yeah, CAYA participation in New Horizon Technical Workshop, Mitsubishi CAYA Eswatini and Joshua CAYA from Kenya participated in panel on transition in HIV care, as you can see in the photo, where they shared the experience, highlighted challenges, noted the occurrence and impact on adolescent and young people living with HIV experience concerning transitions of caregivers and living situation, led to the inclusion of a chapter focusing on supporting adolescent and young people living with HIV, expressing various types of caregivers, transition including child-headed household. Next slide. Caregivers. This may be permanent situation until they reach adulthood, and temporary places of residence until they move to another home or boarding. Changing homes and places of residence or revolving caregivers can have significant impact on young person's ability to maintain adherence and retention in care. This can occur for several reasons, including moving away from the clinic the child, adolescent, or youth had attended, and or moving in with relatives or peers who are unaware of their statuses and unprepared to meet their needs. Next slide. Yeah, stakeholders consultation and site visits. Loza CAYA member from Zimbabwe. I myself, Joshua, we participated in a consultative meeting at the ministry and also had on-site visit to a local sales facility that was in Mubende. In the photo is I myself, Joshua and Cosma and other young people, young people and adolescent peer supporters at Mubende Regional Referral Hospital, where we shared about the transition toolkits. Improvements and what to emphasize the streamliness different transitions. Adolescent and young people living with HIV experience, created a new checklist for caregivers during transition, integrated differentiated service delivery guidance into the clinical chapter, clarified role as a source for sites to enhance transition for adolescent and young people living with HIV. Next slide. Thank you so much.
Great, thank you so much, Ishmael. I think we can tell that with great insights from youth leaders like Ishmael, EGPAF really takes this idea that there's nothing for us without us. And so next slide. Oh, go back, sorry. We're gonna wrap up our panel presentation with our last closing speaker related to this topic of treatment experience adolescents living with HIV. I'm going to introduce Stacy Meyer, who is the Vice President of Global Public Health, Operations and Partnerships for Johnson & Johnson. We're going to move a little bit more around the world as she's based in South Africa. She's been an incredible ally supporting adolescents living with HIV and EGPAF's work across New Horizons countries. In general, Johnson & Johnson looks at young people like Ishmael and says, yes, let's figure out how to make sure more of these voices and more of their insights get put into the projects and the work that we support. So amidst her esteemed career and accomplishments with Johnson & Johnson, EGPAF knows her best as this unwavering ally for our work for adolescents living with HIV. She's been willing to go anywhere to learn and listen to stakeholders and ensure success from all points of making this treatment accessible with life-saving donated product and health system strengthening. So she joins us to help close out the panel, give her insights and reflections of lessons as we've heard through this transition toolkit. Thank you so much, Stacy, and welcome.
Thank you, Marianne. Well, first is just to all of the panelists for sharing your experience and your passion and your commitment. You know, I've been with Johnson & Johnson for 22 years and only recently in the last year focused on our global public health dedicated team. And I really do feel absolutely passionate that the collaboration that EGPAF and Johnson & Johnson have working in tandem with governments, healthcare workers, and youth advisors is absolutely critical work. And if you think about the world that we're living in today and how COVID has brought the world to a new meaning of making sure that we treat all individuals and that we have children at the forefront along with adults. I think that the collaboration with the governments, the healthcare workers, the NGOs and industry is absolutely key to our success. And for that, I think it's why I'm so passionate around the work that we're doing together. I think, you know, Dr. Mungongo, to listen to you around the work that Uganda has done and really taking the lead in making sure that the work that's done is locally relevant is absolutely critical to our success. And I applaud you and your team, as I had a chance to visit a couple months back, and it was really inspiring to see the focus and the dedication of really making sure that pediatric and adolescents are understood and that the healthcare systems are really at the forefront of making sure that they get equally as good as treatments as adults do. And I think about the work that's been done in terms of delivering toolkits around best practice sharing. And I think, you know, we'll have to continue to adapt, as obviously we typically host the annual workshop where the ability to share best practice and launch tools and learn from each other is so important. But in spite of not being able to convene into one common place, it's great to see that we continue to have webinars and platforms that allow for this learning to happen. And as we think about 2020 and the teams, EGPAF and Johnson & Johnson are already preparing for discussions to talk about what the future of New Horizons will look like, as again, I think making sure that the pediatric adolescent population is at the forefront of the work that we do. And I also want to acknowledge Ishmael and your fellow colleague youth advisors. You are the future. You actually understand what we need to do best. And I always appreciate that you keep us honest, you challenge us, and that you make sure that the work that we're doing is the most meaningful in the countries that we operate and that we serve. So with that, I just want to say thanks to everyone for all of your hard work and passion. And I suppose our next challenge is, how do we continue to raise the bar, and how do we make sure that we're acknowledging the challenges that COVID also brings to the HIV pediatric population, and how do we work even harder to make sure that that they're getting the access to the drugs and the treatment that they need to live a long and healthy life. So thank you.
Excellent. Thank you so much, Stacey, and thank you so much for the support from Johnson & Johnson on the New Horizons project. So with this, we're going to move into, we've completed all of our presentations. We're going to move into Q&A. I know people have seen the messages in the chat box, and there are a few things that are already out there that we can get started with. The first one I think I'm going to lead with is a discussion or a question and comment around the role of community health workers. And this one I'm going to push to Eleanor and Ishmael, who are kind of in the countries. There's a long explanation about how community health workers are really these linkages. They're adults, but they provide this great assistance in transition of care. And could you talk a little bit more about their role and how this could be done more systematically for adolescents living with HIV?
Thank you very much, Mary Ann. I will give our Ugandan context. In Uganda, we have been able to develop a community engagement strategy, and this strategy is now going to guide us on how we work with our community stakeholders, the expert clients, the mentor mothers, the peers, the caregiver peers, the adolescent peers. We have a strategy that is guiding us as a Ministry of Health on how to engage them. And more increasingly, we realize now that if we are to get to the last mile of the HIV epidemic in children and adolescents, we really must engage the community stakeholders. And in addition to our community engagement strategy, we've also been able to develop communication materials for the different community stakeholders so that they are able to, we are able to train them. We are planning, the material is ready. We are going to train them so that they are able to in turn pass on this message in their various circles, the LC ones when they meet, the religious leaders when they meet, the cultural leaders. We've been able to engage them in the development of these materials. We are working with them to see how they can further strengthen the gap between the facility and the community. We've also been able to come in our recent review of our guidelines and also our HMIS tools. We've been able to include some indicators that will be helping us to track what is happening in the community. Thank you.
Fantastic. So I think it's so important to remember that care and treatment, over time, care and treatment is really changing and evolving, and there's so many critical stakeholders that need to be engaged and be given real specific roles and responsibilities, even for adolescents living with HIV. And I think the tool also includes that as well. Ishmael, did you have any comments about that as a young peer leader who's working alongside some community health workers at facility level?
This document is really good to our young people, and once it is used
Apologies, Ishmael, you're cutting out. So it looks like the Zoom gods are not with us, but I'm glad they were with us when you were presenting. I think we're gonna transition a little bit. One thing to just highlight in the Q&A box, if you're following along now, is that there were a number of questions that were typed in and already answered. So I welcome you guys to check in here. The two main questions were whether or not the tools would be made available. And of course, the question is yes. We will share those links along with the recording and the slides so that people can be able to review this, talk about it, and think about what it means for their own sites and their own organizations and work that they do. There were also a couple real specific questions about clinical care and treatment for treatment experienced adolescents around regimens and genotyping and resistance. And Natella has answered those. Natella, do you want to say a couple words about the importance of second and third line regimens and the work that has been done by EGPAF and New Horizons?
Sure. Thank you very much, Marian, and thank you for those questions. And inevitably arising along the line of the discussion of transition to care, because this is inevitable long-term life journey of somebody. There are very few people who really maintain the lifelong journey of the HIV with just the first regimen. This is possible and it happens, but we all know until we have a cure, this is a very long journey to carry on. There were a couple of questions and I'd like to clarify. The New Horizons Collaborative did not include the provision of the country-wide resistance testing. That is just was not an affordable, and actually would very much interfere with the national flow because different countries have different approaches. The general approach to resistance testing is to do it only with a protease inhibitor failure. You will see as this will evolve in the coming years as dolutegravir takes more place in the first line, because many of you know that dolutegravir is not tested for resistance in the journal panel for resistance available right now, requires separate tests. And we also know that this drug will have a high threshold to resistance. With that said, we are seeing treatment failure, in particular in treatment experienced individuals. And you heard mention it, our work in Washington, D.C., we have a large cohort. We just published a paper on the outcome of treatment experienced individuals switching to dolutegravir. This includes the young adults and adolescents, and still see 50% failure in those who go with the treatment failure into the new regimen, even though it is based with dolutegravir. So going back on the second, third line, I just want to highlight that EGPAF always saw that niche. The journal estimates with the current regimens that about 30% are failing. And we do see now that with we just got our pilot data, we're excited to present it at IS, that with darunavir, ritonavir, and etravirine used as a strengthening backbone regimen, but primarily with darunavir, ritonavir, we're seeing very high rates of suppression and a very highly experienced treatment experienced patients. I'm not going to give exact data until IS is here, but just to say that we do know these regimens work. And there are a lot of work that we are doing also with New Horizons Collaborative to help decentralize and support treatment working groups and decisions being making by clinicians and their capacity to interpret resistance tests and sequence the regimens. If we are looking in the future, I think we're going to abandon the terminology of second, third line down the line. I think we're going to talk more about just sequencing of the regimens. Nowhere in a chronic disease do we talk first, second line. We don't discuss it with the blood pressure measurement. We don't discuss it with diabetes or asthma. We just adjust regimen as the individual lives through, and there are adjustments that are necessary to be done. So we really have a very strong focus on preparing and capacitating, preparing the tools like shared today, and treatment failure tool is one of them, but capacitating the healthcare system to deal with the treatment failure, interpret it, support clients, make sure they become resuppressed, and if the treatment change is needed, doing it well informed with all appropriate tools. So this is just a few words from me on that end, and this has been a really big focus of New Horizons and EGPAF for years. Before I finish, I just wanted to use one more moment, Marianne, to answer. I saw there was a question along with the community about whether the tool addresses issue of working with adult providers. And I just want to say we do. And I work in the US and we don't have adult providers come into our clinics. We accompany our youth to the adult provider for the first couple of appointments to make sure that they work well together. And this is a new team to go along the life. But we did address in the capacity that we could, taking in consideration it's relatively short tool, but we do speak about building relationship with an adult provider, getting them familiar with your populations, bringing them in if possible or coming to them when necessary, but primarily to making sure that MDT or multidisciplinary teams from both facilities talk to each other, and all the aspects of the young person are well known, not only to those who have been with the young person for years, but those who are taking the young person into their care. So it is addressed in the tool. Marian, I stop here, back to you.
Okay, thanks, Natella. That's fantastic. I appreciate you doing 3-in-1 question, three answers in one. Okay, so we're going to shift gears. I see a number of more questions are coming in that are quite open-ended and interesting. I'm glad we can do this. So the next one I'm going to direct to Julian, because the question is around how can we make sure we use more national, local networks of adolescents and youth living with HIV as a community of adolescent youth advisors. And I'm directing to Julian because I think we've heard EGPAF systematically has CAYA, so we have this way of ensuring all the time young people are engaged in the work we do. Uganda, Eleanor, you gave a really great example of how committed you are to making sure we have this youth cadre of youth adolescent peer supporters, YAPs. So Julian, can you talk a little more about what advice you would give about how we can, anyone listening who's from a different organization can better engage these networks?
Yes, thank you for the question. I think, as you know, we are now in an era where definitely youth engagement and engaging with adolescent and young people living with HIV is essential for any project specifically targeting their needs or their challenges. What I would suggest when we are talking about, because there is different level of engagement, local, regional, and global. When we're talking about engaging young people at the local level, it's important that the local organizations engage with young people while they are still in the process of even designing the projects. So in the first process, while they are designing the project, there should be a group of young people who are actually saying how do they want the project to look like, and then in the process of developing the proposal towards actually reaching the stage of implementing the projects, young people need to be engaged from A to Z. When it comes to global networks and global coalitions and even regional coalitions and networks, it's important to always have seats on the table for young people in every decision-making platforms. What we do at the ATC is we have young people who are representing either regional, global, or local networks of young people living with HIV who are members of the ATC, and we are as well currently in the process of moving even more and more towards actually becoming a youth-led coalition and fully giving the decision-making process to the youth-led networks, whether they are local, regional, or global. Thank you.
Great, thanks, Julian. And I think that's really important to just make sure that we're always at the table with people whose lives are being affected by the decisions we're making. I'm going to switch gears. Another question I'm going to actually direct to Cosima. And the question is around learning more about the transition of adolescents during pregnancy and after childbirth. We know at EGPAF, this is something that we've built our foundation on with our experience of Elizabeth Glaser directly. But I know that sometimes we take for granted that these life transitions will happen, and this was a really important chapter and model to approach. So Cosima, could you talk more about how transition for planning pregnancy and after childbirth is described for adolescents in this case?
Sure, sorry, still on mute. Thanks for that question. So I think the section in the toolkit is really detailed in terms of providing more comprehensive information around this transition and its unique needs. As we said before, it sort of outlines some of the unique challenges that these adolescent girls and young women living with HIV sort of face in this transition. That can be both from the societal level to facility at the provider level, as well as the individual level, which is going to affect both their experience and their ability to transition successfully between HIV and general HIV care settings. And so the figure on the slide that was shown during the presentation sort of gave more of a visual overview of some of the elements in that care that can be attended to, from planning more prior to pregnancy and then during pregnancy, which could include specialized PSS, as well as household support, and PMTCT, which could include adolescent girls and young women friendly provision of services, which could include, for example, appointment booking, an appointment booking block for adolescents and young women who are mothers and are expecting. And then after delivery as well, which could include support for young mothers and for their infants, and mother-baby PSS, and as well as partner support. And I think some of the steps also outline more in detail about those, and it also provides some more suggestions around models of care, as I mentioned in the presentation itself. Yeah, thank you.
Yeah, thanks so much, Cosma. I also think what the tool does is just normalize the desires of any adolescent growing up with HIV, that they have the same interest to become a mother and have children, and do it in a planned way, so that it can not be something that's seen as an issue, but more of like, how do we make this part of your life and your plans and do it safely? So thanks for that, Kosama. And so the next question is, I'm going to skip around a few things. Some of them are specific for EGPAF and some are a little more general and help us learn a little more from insights of speakers. So the next one is actually for Ishmael. I hope your connection is a little better. Can you talk a little more about the importance of social protection services to address non-adherence, non-clinical adherence, not things that are beyond resistance or regimen? What around the social protection of adolescents needs to be addressed in transition? And so Ishmael, I hope your connection is good, and if not, Eleanor or Natella, if you could jump in. And you're muted, Ishmael, right now. Eleanor, do you want to jump in on the importance of integrated social protection?
I can jump in, Marian, if...
Thanks, Natella. Maybe there's an issue.
Is Ismail now talking? No. Okay, just to say that this is an extremely important issue, and I think that we have witnessed it all over the world. I just don't want people to think it's unique to, there is no country in the world, and I've been to quite few, and I work where the social protection issue is not affecting the adherence, the capacity to live with chronic disease and transition challenges. And this is a really important question, because the word holistic is used, and I am all for holistic approach in care, because you cannot just tell somebody they have health condition, these are the pills, and that's it. You really need to look at the life. We know this from multiple studies, models, and just from daily work with our clients. I think, to me, and something that we really instilled into the transition tool, is multidisciplinary team approach is our answer. And multidisciplinary team, not limiting by any means to healthcare workers. This includes community workers. This includes wide outreach when needed. These are the liaisons of multidisciplinary team. But it is really a capacity of looking at the individual as a whole, and not looking at only his viral load or his medical status, physical exam, and making decisions around this. So we very strongly promote MDT's multidisciplinary team approach, and really list the role of multiple stakeholders. In a school component, we really enhance bi-directional communication with the school, and do make a provision saying when the school is not in place, the community. On the end of the caregiver, which is also social protection, when the young people are losing the parents or losing the family for whatever reason, and moving along the cascade of foster homes, or anyone who accommodates them under the roof, These are to us elements of social protection. And finally, very strongly try to replicate it in the issue that's been raised before, is a pregnant young women, young mothers, the element of gender-based violence and being able to place them in the conditions where they have access to decent living, the support financially as well. We all know that social protection is a neglected element under many, many systems in the world, and we've been addressing it long time, but we interpreted our elements of social protection in this tool by really going after concrete channels of what constitutes this young people's life way outside of the diagnosis and living with HIV and the treatment needs, and trying to approach their lives more holistically. So this is probably the answer to very, very complex and difficult question, and I hope we've done at least some justice to this very, very needed area to assure the lives and reach the goals and mission we have.
Thanks, Natella. I think we have about 5 minutes left, so I'm going to take the opportunity to ask one of my own questions. I know we've gone really deep into the idea of transition and how changes happen in young people's lives and how it's amplified when you're living with HIV and you have to take a medicine every day. And I wanted to also ask, I see Eleanor's not muted, so maybe I'll let her lead. How do we think this work in transition for the New Horizon Project also transcends just HIV to sort of look about their adolescents' experience with COVID-19? We know many of them have stayed home and now will come back into care, and they won't be in groups because there'll be social distancing. Is there things that we can take from this tool that will help us make sure that adolescents continue to stay on treatment? So Eleanor, can you lead for that?
Thank you very much, Mary Ann. I had unmuted just to add to what Natilla had said. Maybe I can just start there and quickly go to the question that you've asked. I wanted to add to what Natilla said, that if we are to look into issues of social protection to see how we can help our adolescents in our HIV clinics, we must strengthen the multi-sectoral approach, because, for example, in Uganda, the social protection related issues are handled by a different ministry, while the HIV clinics are run by the mainly or coordinated by the Ministry of Health. So if we are to talk about social protection and how this relates to adherence, it's very important that we strengthen that multi-sectoral approach. And also, to give an example of Uganda again, you find that in the Ministry of Gender, Labour and Social Development, there are livelihood projects, but if the Ministry of Health does not work closely with that ministry, then the adolescents in the HIV clinics will not be able to tap into those opportunities to improve their livelihood, overcome poverty, and we know how this interacts with taking their medications and therefore adherence. So moving on to the next question, how this tool can help us even beyond HIV into the COVID-19 period. I think we have opportunities with this tool because we have seen that the tool offers very clear guidance, a step-by-step process of how healthcare providers can work with the different stakeholders in the clinics, the caregivers, but is also, the tool also helps us to understand the dynamics around the different subgroups. So I think one of the things I would probably say is maybe a question for all of us. How do we use the electronic platforms using the transition tool? Is it possible for us? Because I know that in Uganda, one of the things that we are doing is we are developing an electronic platform to see how adolescents can still counsel and follow up on their colleagues using the different virtual platforms. So I would probably answer by asking a question: how can we work within this tool to create an electronic platform, or to put it in a format where the young people are still able to counsel their friends even when they are not able to meet physically? So if the tool is to be relevant even beyond the HIV circles, knowing that most countries are in the lockdown, people are not meeting as we normally do. I think we now need to begin thinking how we can utilize this tool on virtual platforms and still use the health workers, the different peer supporters to still be able to provide a service using the tool, even when we are not meeting face to face. Thank you.
Wow, Eleanor. Okay, so thanks for giving us more to think about as we are taking this presentation on the New Horizons Project and tools to a webinar, and also thinking through what else needs to be taken virtually during this COVID time. So we appreciate that. With just about a minute left, I just wanted to wrap things up and say a big thanks for everyone who was able to stay on through the entire 90 minutes from all these time zones around the world. And give a special thanks to EGPAF's external affairs team and all of our speakers who've made this happen of all ages, especially the leadership at EGPAF, Trish, at Johnson & Johnson, Stacy, and with the Adolescent Treatment Coalition, Julian. We really do appreciate your commitment and support of these kinds of tools and resources, and all the participants and those who joined who can hopefully help take a look when you get the email and you can see the tools, share it among your networks, and encourage additional webinars during this time so that people can think more about how to have uninterrupted care, especially for our adolescents and youth living with HIV. So thank you all very, very much and have a great day.